Hi everybody. In the last several videos we've been talking about Dr. Bredesen's ReCODE protocol for reversal of cognitive decline, which has been a crucial program for my dad. Dr. Bredesen's team has helped hundreds of people reverse their cognitive decline, establish mild cognitive impairment, and Alzheimer's disease with this protocol as evidence in successful studies in 2014, 2018, 2022, and current clinical trials. Today, we're continuing on with the Cognoscopy, Dr. Bredesen's evaluation to screen for all the potential contributors and risk factors for cognitive decline. All these tests and lab results paint a clear picture of where a patient stands and helps identify how they got there. It is the foundation for an individualized protocol to be built out for prevention or reversal. On the last episode, we specifically talked about the very important mineral zinc. Next up, we're getting into another critical mineral, selenium. Okay, so how does selenium relate to brain health? Selenium is an essential trace mineral that plays many important roles in brain function, including protecting it against oxidative stress and inflammation. It supports neurotransmission, the communication between neurons, maintains brain homeostasis, balancing and supporting its immune function. Yes, the brain has its own immune system. Selenium can influence hormonal activity in the brain, affecting mood and behavior, and it counters the neurotoxicity of heavy metals like mercury, cadmium, lead, and arsenic. Selenium can promote new brain cell growth and make it more resilient overall to stress. Selenium is found in the brain in higher concentrations than in other parts of the body, and a deficiency in it can lead to a mental fog, among other symptoms. This powerful mineral has been shown to slow age-related mental decline and even reduce heart disease risk. Dr. Bredesen calls it the firefighter mineral because it does such a good job of neutralizing free radicals that can cause DNA damage. And one of the most important ways it does this is by helping regenerate the most powerful antioxidant our own bodies produce, glutathione. We'll dive deeper on glutathione in future videos, but it's not surprising that reductions in both selenium and glutathione have been shown to be associated with cognitive decline. Selenium is also essential for overall body antioxidant activity, protecting cells from free radicals and helping prevent chronic diseases such as cancer. Thyroid function. Selenium is essential for the production of thyroid hormones, which regulate metabolism, growth, and overall energy levels. Immune function. Selenium supports the immune system by enhancing the activity of white blood cells and reducing inflammation. Reproductive health. Selenium is involved in sperm production and motility and is crucial for fetal development. Deficiency can lead to infertility and miscarriage. DNA synthesis and repair. Selenoproteins are involved in DNA replication, repair, protecting the genetic material from damage, maintaining healthy hair and nails, supporting cognitive function, and regulating blood sugar levels. Now, symptoms of selenium deficiency can present as fatigue, muscle weakness, joint pain, infertility, heart disease and high blood pressure, confusion, memory loss, anxiety and depression, thyroid dysfunction and hypothyroidism, diarrhea, nausea and vomiting, hair loss, brittle nails and skin rashes, increased susceptibility to infections, impaired immune function, and increased risk of certain cancers like prostate and bladder. Selenium deficiency is no joke, but most neurologists don't really test for selenium. To support healthy cognition, Dr. Bredesen wants us to measure selenium in our serum. Optimal target is for selenium to be between 110 and 150 nanograms per milliliter. To get our selenium levels into the optimal ranges, we first need to know how deficiency can happen in the first place. And common causes for selenium deficiency have been not getting enough in the diet, malabsorption and digestive dysfunction, kidney failure, and pregnancy. Because selenium is so essential to fetal development, the mother transfers most of her selenium to the fetus, which can lead to a deficiency in the mother if adequate selenium is not coming in every day. This deficiency can worsen during lactation, so this trace mineral is crucial during pregnancy and postpartum. Please check out episode 27 for Dr. Bredesen's recommendations on healing the gut and improving digestive function, and also check out episode 16 for Dr. Bredesen's anti-Alzheimer's diet to cover all our nutritional bases. The current recommended daily intake for selenium in adults is about 55 micrograms per day. For pregnant and lactating women, it's about 60 to 70 micrograms per day. And the highest selenium concentrations can be found in foods like Brazil nuts, tuna, halibut, sardines, salmon, shrimp, turkey, beef liver, chicken, eggs, crab, and lobster. Because digestive dysfunction has become so prevalent and the average nutritional value of our food supply has also diminished, if selenium blood levels are suboptimal, Dr. Bredesen recommends supplementing with a well-absorbed form of selenium like selenomethionine or selenium-enriched yeast. So, To recap, Dr. Bredesen's optimal selenium blood lab range is serum selenium between 110 to 150 nanograms per milliliter. A 2011 study in 40 Alzheimer's patients showed stabilization on a measure of cognitive decline following higher doses of selenium. Another 2019 trial found that the use of selenium in combination with a probiotic had a minor benefit on the same cognitive measure, but no effect was seen with selenium alone. Once again, this demonstrates how when only one target or one pill or one supplement is added, it's often not enough to move the needle with Alzheimer's. But when selenium can be combined with multiple other targeted therapies, like in Dr. Bredesen's ReCODE protocol, amazing health outcomes can be achieved. I've linked these studies in the description below so you can check them out. Dr. Bredesen prefers we get most of our selenium intake from food, but definitely consult with your medical practitioner if supplementing and test levels often to see where you're at. Please check out episode 12 to see how to test and what kind of doctor can help you with testing and managing the protocol. And I'd love to hear from you. Has your neurologist ever spoken to you about selenium levels? What do you think of this video? Please drop me a comment. If you found this information helpful, please feel free to share this video with anyone you think it could serve, and please like and subscribe as it helps our community grow. And remember, I'm not a doctor. I don't have a PhD. I'm a caregiver and citizen researcher on the ground, helping a loved one, someone just like you. This information is for educational purposes only. Please consult your medical practitioner before implementing any changes. Thank you for watching. My dad thanks you. Hope these resources are helpful to you and your family, and see you in the next video. Thanks.